important.
Okay. Thanks.
Thank you, ma.
The next speaker is Dr. Gemini Isaac. Neuroophthalmological confounders for optic disc-cupping when it is not glaucoma.
Shall I start? Okay. Good afternoon, everyone. We ophthalmologists are well celebrated because we are protecting vision. Suppose we are able to protect along with vision life as well. How marvelous it will be. This is all about my study. We will see at the end of study how it will be possible. My aim of the study is to introduce two confounders which mimic glaucomatous disc cupping, but missing it could be dangerous for vision and life as well. We selected 85 patients for the duration of 8 months from a tertiary care center in South Kerala, and patients above 18 years with optic disc cupping, which if proven to be glaucomatous, were selected for the study. So, if all the selected patients were undergone thorough evaluation from our glaucoma department with the help of OCT, CCT, visual fields, and slit lamp biomicroscopy to confirm that these cases are non-glaucomatous, and we proceeded with the study, and we included patients above 18 years of age and a subject cooperation for media clarity and good fundus and OCT pictures, and OCT signal strength more than 3 were also included. We excluded all the suspicious cases of glaucoma and other neuroophthalmological confounders which can cause cupping, like optic neuritis, ischemic optic neuropathy, those cases, and retinal causes for pale disc, myopic fundus, and poor vision, which will prevent us from taking a good fields. If all patients were selected based upon inclusion and exclusion criteria, we took informed consent from all patients, and they all underwent thorough ophthalmological examination with the and we did slit lamp examination of the anterior segment with the help of 9DD, and classified this cup disc ratio normal up to 0.3, moderate 0.4 to 0.5, severe 0.6 to 0.8, and we differentiated with the help of disc cupping with pallor, without pallor, field defects, bitemporal, homonymous central defect, OCT RNFL with borderline thinning, global thinning, and imaging shows paracellular and cellular mass. This is the distribution of the total 85 cases. I will come to one by one. This 32 cases, this referred from Neurology Institute from our nearby center, and among this, all these 32 cases, they already imaged and found cellular or paracellular masses. They sent to us to roll out compressive optic neuropathy. The surprising thing is, among these 24 cases, field defect, OCT RNFL thinning cupping with present for the 24. But in the 8 cases, this is I want to highlight the non-field defect, no OCT RNFL changes, but only significant cupping. These cases are means already imaged with unfound out cellular or paracellular mass, but cupping only is the early feature. And the 12 cases which detected from our outpatients, 9 had field defect OCT RNFL changes along with the pallor, 3 had field defect only, no pallor on OCT changes, but 12 we imaged because we have either field defect or OCT changes. The 12 cases we imaged, we found cellular masses or paracellular. Surprisingly, these 5 cases, more than 3 centimeter in size, immediately they got date for the surgery, and 7 cases, very small lesion, less than 3, they got very late date for the surgery. And this is a distribution based upon percentage. You can see cellular masses are 62% from our study. Trauma cases comes at 12 cases. And the distribution, you can see the...
Relax. No issue. Take 5 minutes, deep breath, and then talk.
This is the distribution based upon the OCT RNFL changes. You can see OCT RNFL also showing temporal thinning more. This is means if it is the thinning is borderline or global, it is a temporal. And the disc cupping, you can see disc cupping with pallor when has the vision ranges from 6.6 to 6.6, that is poor vision. And field defect also, the patients with the cupping and field defects also has poor vision, and no pallor, no cupping, no field defects, 6.6 vision. So, coming to the discussion part, we know the optic nerve cupping or enlargement of the cup disc ratio is widely recognized as feature of glaucoma, but non-glaucomatous cases like compressive optic neuropathy, ischemic optic neuropathy also can cause cupping. So, what is the cause for this cupping? Prelaminar cupping is a shallow cupping which is more commonly associated with non-glaucoma, and the glaucomatous cupping usually laminar cupping which is deep. And so, non-glaucomatous cupping, usual dictum is pallor more than cupping. You have to evaluate. So, I am going to break that. The present study, disc cupping without pallor or OCT RNFL changes or field defects could also be early compressive optic neuropathy. So, early chiasmal compression due to cellular or paracellular mass and disc cupping without pallor or pallor less than cupping. What will happen? Such a patient comes to the OPD. There is every chance that general ophthalmologist may misdiagnose it as glaucomatous optic neuropathy or physiological cupping. My study is to prevent that. Though screening gives prevent vision loss by detecting early compressive optic neuropathy. Then what will happen if pallor is more than cupping? A late stage detection that will lead to subnormal vision recovery, post-op, cumbersome surgery, resurgery due to residual lesion, subtotal decompression, recurrence, and craniotomy. You know the preferred route is endoscopic approach. We won't be able to approach that if the size of the lesion goes more. It's like that the post-trauma cases. It also has a very chance to misdiagnose as asymmetric glaucoma. So to differentiate that, visual field and OCT RNFL will help you to differentiate from glaucoma nasal. So these are the common few cases and these are the studies, but none of these similar studies show non-glaucomatous disc cupping without a pallor also a feature of early compression. Conclusion, we are able to successfully introduce two non-glaucomatous confounders as an early feature of compressive optic neuropathy. We hope other investigators are able to continue different aspects of the study, and this signifies the need of routine screening and follow-up with visual field OCT RNFL. This is one video of endoscopic resection. This is the less means a most accessible route and less morbidity. So if you are able to detect a case, you will be able to protect the patient, not only the vision, life as well. Friends, when Sanju Samson scores a century, we enjoy. Kerala gets century, gold medal in Santosh Trophy, we will also rejoice. One of our patient gets a reward, we will enjoy. So suppose we are able to protect vision as well as life, how marvelous it will be. Thank you, sir.
All this cupping, did you compare the disc size? So you have shown only the cupping, whether you are comparing the larger disc or smaller disc, any comparison you have made?
Usually, no sir, actually I didn't. It's only cup disc ratio only taken.
So do you think that is also important?
Yes sir, definitely. And the cases we selected as physiological cupping without pallor or field defect, that 31 cases we are keeping under follow-up. Is it a physiological cupping, or in due course of time will they develop a field defect? That we wanted to see.
So you didn't show any field effect, the bitemporal, no? You showed some cases at bitemporal hemianopia.
No sir.
No, I thought I saw bitemporal. One of the green slide background.
All the set.
Go there. No. Somewhere I saw bitemporal. No. Okay. So no bitemporal, huh?
No, bitemporal field defects, it's already known that it's a compressive optic neuropathy. My highlight is without field defects and cupping.
I agree. But some you had bitemporal, isn't
yes,
it?
Sir. Yes,
you
sir.
had. So glaucomatous this change can mimic a neuroophthalmic. That is understood. So you have any other study? Did you show any study where this kind of comparison that has been done?
Yes, sir.
You are not shown here. References, you didn't compare.
Okay.
No, okay. That is equally important, no?
Yes,
So how different it is from any other, or is the same in line with? So what you are trying to convey is it is better. You keep it in mind that it could be a cellular or paracellular, which is more life threatening than
Yes, sir.
vision threatening.
Yes, sir.
Correct. Okay, ma. Thank you.
Thanks.